Question number 1. What is platelet rich plasma PRP? Answer. Platelet rich plasma, or PRP, is a type of regenerative injection therapy used to treat many soft tissue injuries. Question number 2. How is platelet rich plasma therapy performed? Answer. PRP involves taking blood from a vein in the arm and placing it into a special centrifuge. The platelets are separated from the rest of the components of the blood. The platelets are combined with a special substrate to enhance the effects. This is then injected into the injured or painful area. Once healing takes place, over the course of a few weeks, the pain should lessen. Question number 3. What musculoskeletal conditions can be treated with platelet-rich plasma? Answer. Neck and back pain, shoulder pain, rotator cuff injuries, knee pain, knee bursitis, tennis elbow, golfer's elbow, chronic ankle pain, Achilles tendinitis, hip bursitis. Question number 4. How do I know if I am a candidate for platelet-rich plasma? Answer. A consultation is required before any treatment may take place. The consultation includes a comprehensive review of your complaints, medical history, and a thorough examination will be conducted. Diagnostic studies will be reviewed and/or ordered at the time of the consultation to determine the cause of your complaint. Question number 5. Is platelet-rich plasma painful? Answer. While everyone's pain tolerances vary, patients report a range of discomfort from mild to moderate with PRP injections. A needle is used to draw blood from a vein in the arm initially, and then small needles are used to perform the actual injection. Question number 6. How many injections will I need? Answer. Typically 1 to 3 injections. Much of this depends on the chronicity and location of your problem. Some patients can successfully be treated with 1 injection, while others require multiple injections over a time period to eliminate or reduce pain to an acceptable level. Question number 7. How long does platelet-rich plasma take to perform? Answer. Depending on the number of areas being treated, most procedures will be completed in 30-45 minutes. Question number 8. How long does the effect from platelet-rich plasma last? Answer. This is different for everyone. Much depends on the underlying disease process and whether there have been a recurrent injury to the affected area. It is impossible to predict if and when further treatments will be needed for a specific condition. In some cases, patients do come back months or years later for repeat PRP injections. Question number 9. What is the success rate of platelet-rich plasma? Answer. It depends on various parameters like health status of the patient, age, and treatment protocol. Success is also highly subjective and dependent on the patient's perception. Success rates reported in the literature have been largely anecdotal. It has been reported in up to 80 to 90% in some studies, Achilles tendinitis 70 to 80%, and golfer's elbow medial epicondylitis 60 to 70%. Question number 10. Can I be allergic to the solutions injected? Answer. Although extremely rare, some patients may have an adverse reaction to their own serum. It is also possible to have a reaction to the substrate that is used.